Hi, I'm Giselle Bellinger and welcome to Dragonfly Health Services. I decided to create this webpage because I was always sending my patients to the internet to look up something or referring them to a book or even to some of the articles that I've written. So I decided to put them all together and make them available to everyone. You'll notice that they're categorized by topic, and hopefully that will make it easy for you to browse. If I can provide any clarity or there's anything that you wondered if you had a problem and that can help, then that would just be wonderful. If you also decide that you'd like to call for any kind of consultation or therapy, I'm available. That was the other reason I created the webpage, so that it didn't matter where I lived or where you're located. Thank goodness for Skype and the telephone that we can reach out and be available to each other. Early on in my career, I decided to specialize in addiction because one way or another it was coming in the door. Whether it was the addict or alcoholic who had the problem, or somebody who was married to one, or if you'd grown up in a home where there was an alcoholic. These problems seem to linger and interfere with other times in your life. And so the specialty has become very necessary in terms of couples therapy, treating an individual, or even a family. I also, in my personal life, my father had Alzheimer's, and we had him at home for about 12 or 13 years. The first 6 months we had him in assisted living. We learned a lot about that experience and dealing with doctors, the different medications, and how to advocate for him. We also learned to bring people into the home to help take care of him and what to do and what not to do. So I thought that would be an excellent way for me to provide that type of consultation and information and somebody to talk to. It's also really difficult for the family to decide what to do or even to agree on what to do, especially when it's the adult children who are trying to decide what to do for their parent. So if you're in that situation, you may find that I could be of some help. My sister Julie has Down syndrome. She's 41 years old, and she's a marvelous person who's done incredibly well in her life. And it's another area that my family certainly learned a lot, and maybe we could be of some help. If you're the parent of a Down syndrome, or you know somebody with it, you also may find that picking the phone up and calling and having somebody to talk to would be helpful. Of course, in my treatment of patients, I treat couples and relationship issues, depression, and many of the other things that come up. I also included a category called personal growth because I think so many people struggle with letting go of anger or being able to forgive, or just even how to embrace change. So please feel free, browse the articles, find the topics, and if you'd like to pick the phone up and call me, I do offer the first 30 minutes for free. I think it's important to make a connection and to be able to feel the empathy, to feel the confidence, and that there's trust. And then after 30 minutes, we could decide if there's any way that I can help and that you would like to have any more sessions. We can talk about it at that time. Don't worry about if it's consultation or therapy because it's always mixed together anyways.